to carry the COVID-19 burden. They experience the worst of this virus every day. So tonight we'll give you a raw account of just one doctor at one of the country's COVID-19 referral facilities, Johannesburg's Charlotte Maxeke Hospital, not too far here from the SABC. So this doctor is currently on call. She's on duty and has taken a moment to speak to us this evening. Dr. Anele Ntanjana, she works at the emergency unit at the Charlotte Maxeke Hospital. She joins me now live via Skype. Dr. Ntanjana, very good evening to you. Thank you very much for taking a few moments to speak to us just as your shift begins.
Thank you, Cassandra.
Dr. Ntanjana, I see you already basically starting to begin your shift this evening. Take us through what a typical 13 to 14 hour shift looks like for you and your colleagues amid the COVID-19 fight.
Right, so in general, when we do come into work, we have to do checks on each other. We have to check our temperatures. We have to check our symptoms and essentially make sure the team is okay to actually start and nobody is symptomatic. Over and above that, we then have to wear our PPE, which may be extended PPE depending on the area that we are designated to. Thereafter, we then take a handover and then we see the patients. And it may range. Some nights are better than others, but over the last couple of weeks, it's been quite demanding on us. There have been a lot of patients coming through. The patient burden is much higher now from all the things that we had been seeing before, and then COVID over and above those struggles that we've had before. Yeah.
Dr. Ntanjana, I can only imagine the pressure of work and what you and your colleagues are going through. I understand that you're seeing more patients with respiratory conditions. And in addition to the pressures of work, talk to us a bit about that and the lives that you also live outside of work. This must come with massive emotional strain for you and your colleagues. Are you feeling that?
So we are starting to feel it, definitely. So we have definitely had more respiratory patients come in, but also patients with previous comorbidities who have COVID on board as well. And that is quite difficult. They're coming in quite critically ill with increased numbers overall. There is anxiety obviously associated with that, not only because obviously the patients pose a risk to us, but also because it's much more ill patients to have to deal with on a system that in general is known to already be quite burdened. Over and above that, there's obviously things we have to deal with outside of here. We've had colleagues that have fallen sick, most of which have recovered, thankfully. But also family members who've fallen sick. And we have to continue working through that while trying to support our family members, but also not being able to visit some of our families. So a lot of us have not seen our families for months. Some people have had to move out of home because we are a risk to our families because of our job. So it does take quite a bit of personal strain over and above that, on top of an increased work burden. Yeah.
I'm not at the Charlotte Maxeke Hospital with you this evening. Your shift has just started. What is this evening likely to look like for you? I'm sure you must have received some kind of brief. Going to be more hectic than other days or not?
So this evening is, knock on wood, looking slightly more bearable. But obviously it really depends on what the night holds, and that I cannot say. So it may vary. But for now, we do have things under control. Yeah.
I mean, while you have to navigate issues of work and also your personal lives, you've not seen your families for months, you've had to move out of home. I also understand, and you touched on that a bit, that you're seeing more patients with mental health issues. And this could be related to quite a number of things. Anxieties of what's happening in the home, families that have fallen sick. How do you manage that and also still keep a calm head? I guess this probably goes through your training when you do become a doctor, but I cannot imagine what you must go through. This is a whole new issue that everyone is dealing with.
This is obviously an unprecedented time, and it's very difficult trying to sort of treat patients as well as trying to console family members, while at the same time trying to make them understand that they can't keep visiting, they can't keep coming in to see their family members because that poses a risk for them as well. The hospital is obviously a high-risk area in itself, and it is difficult trying to balance that. Obviously, we have had training from medical school, but it's different being in the thick of things. And yeah, just trying to balance it while trying to balance people's emotions and the despair. And it is tough. We try to do the best we can. When it is very overcrowded and that it's a bit more difficult to manage it, as you can imagine. But yeah, we do the best we can.
Doctor, I understand the sacrifice that you make there, and I think I'll speak for many South Africans if I said we really do appreciate what you and your colleagues are doing, but there seem to be people who don't really take it seriously. What would you say as someone who every day risks her own health in order to try and save others? What would you say?
I would say to everyone that, that this is real. Coronavirus it's not a joke. It's not a hoax. It's a very real disease for which people are coming in very sick. People are dying. It's very real. It's important to stay home. It's important not to leave home unnecessarily. And just over and above that, to just take care of yourselves, take care of everyone around you. The numbers are rising. The threat of coronavirus is much higher now than it was before. Just because lockdown regulations have become more lax does not mean it's getting better. If anything, the threat is much higher now. So please, everyone be careful. Do not leave home unnecessarily. And just take care of each other. The unfortunate thing about the coronavirus disease is that even if you have a mild disease and you just have the flu, it's everyone at home, it's your work colleagues, and if they catch it from you, it may not be just the flu for them. It may not be just the flu for somebody else, and they're going to come to hospitals, both public and private, that are already taking quite a bit of strain. And with the numbers rising, it's likely that we will become quite overburdened with time.
Dr. Anele Ntanjana, I really appreciate you speaking to us here on the program today. You've just started your shift at the Charlotte Maxeke Hospital. I know you're extremely busy there at the emergency unit. Thanks indeed for speaking to us this evening, and thank you for the work that you and your colleagues do. Thanks for taking out time to speak to us just before your shift begins. Thank you very much indeed.